Hello, this is Dr. Stanley Lang again, and welcome to this video. This is a follow-up video to the training video I gave on tick removal, and this video is based on what should I do in terms of treatment if I have a tick bite. What's the probability that I'm going to get Lyme disease? Well, the problem with that is that in the United States, Lyme disease is totally underdiagnosed because our testing is totally based on relatively gross advanced stages of the infection. You have to have triggered the immune systems enough to turn our immune test positive, for the test to be positive enough for you to be diagnosed with Lyme disease. And I can tell you for sure that the Lyme organism can be in you without triggering any of that immune response for quite a long time. And in some cases, the tick bite happens years before the person gets their first actual symptoms of Lyme disease. So the question is, well, if I know I have a tick bite and I treat it early, can I avoid getting chronic Lyme disease? Well, that hasn't been studied very well, but partly because it's only been in the last couple of years that the CDC has even admitted that chronic Lyme disease is something that exists. But in my experience, if you treat somebody with a tick bite as if they have early Lyme disease, you do decrease the odds of them getting chronic Lyme disease. Now, I can't prove that point because the research I don't think has been well done, but I can say that in my experience, that has been my experience. And for me, the cutoff for treating for a short amount of time is 10 days or less. So if I can catch somebody in the earliest stages of treatment, then I think there's a chance that a short course of treatment can decrease the odds of getting chronic Lyme disease, which is what you really want to avoid. Acute Lyme disease is no fun, and it's definitely not a picnic, but chronic Lyme disease is definitely a big deal that you want to avoid if you can. So the current standard, again, in the United States is not based on any research. That's the problem. So if you go to emergency room, the odds are that if they, for your tick bite, the odds are that if they treat you at all, they'll give you 1 dose of doxycycline or some similar antibiotic. And I can guarantee you that there's no research to show that that makes any difference in having chronic Lyme disease, because you'd have to follow people for years carefully to know whether they have caught the Lyme disease and whether they're now starting to manifest with chronic Lyme disease. 1 dose of an antibiotic is not going to wipe this organism out. It is way too clever in terms of its defense systems. Now, the question is, well, how long should you treat? Well, my experience has been, that the advice of 10 days of treatment tends to be very effective in terms of not seeing that patient back with later manifestations of Lyme disease. Now, if I see them in their 2 weeks after the bite, I assume they've already got chronic, they've already got widely dispersed Lyme organisms, and I offer them a longer treatment course. I don't tell them they need it because the research doesn't support one way or the other. But the problem with what we're experiencing nowadays is that a lot of people get many tick bites a year, many tick bites even in a month in some cases. Are you going to take an antibiotic every time that you get a tick bite? Well, that's one option. I don't recommend it as being the best option, but it is an option for some people. But taking 10 days of doxycycline over and over again is probably not the best thing for your gut. Now, years and years and years ago, that was a drug that was used for kids with acne, and they would take it for a whole year and doctors wouldn't blink. But nowadays, we're a little bit more sensitive to the idea that this is maybe not so good for your GI biome. So the alternative that I offer patients, especially if they're getting recurrent tick bites, so maybe the first time around we'll go with doxycycline if they want to be treated, and most people do, just to be on the safe side, because there's no way to know, there's no accurate test, and you don't want to wait till you get sick. The alternative is to use an herb that has been shown in the test tube to kill the Lyme organism, and it's called stevia. Now, the stevia you buy in the store is not what I'm talking about. What we're talking about is whole leaf organic stevia, and it's so it's a green powder. It's got an earthy odor to it, and I've been using it for many years successfully to treat Lyme disease. It's part of our treatment, so it's not the whole thing. But as an alternative to taking doxycycline, one thing that you could do would be to use the whole leaf stevia, 1 teaspoon twice a day. Now, that much whole leaf stevia is way too much to take at once. So you're going to mix it with a smoothie or something like that. And then you would drink the smoothie twice a day, or something like a thick drink. So milk alone, because it doesn't dissolve very well, is part of the problem. But mixing it with kefir, for instance, is perfect. If you have kefir, you can mix it up, or you can mix it with yogurt. So a full teaspoon of this organic whole leaf stevia, and then taking it twice a day for 10 days is kind of equivalent to the idea of taking doxycycline for 10 days. Now, it might even be better because stevia penetrates biofilm way more effectively than any antibiotics. Now, you're going to find out there that there are people that say there's no way that stevia can work because it's not absorbed from the gut. But it does work, and it's transformed to a metabolite in the gut that's absorbed and kills the Lyme organism. So it's very effective as partial treatment for Lyme disease, and sometimes that may be all you need to do. There's no way to test, did I get it all or not? So this is just a different strategy. It's simple to have on hand at home. You can buy the stevia online. You just make sure it's organic, whole leaf, and it's going to taste and smell earthy. I happen to like it when mixed with kefir. I've had one patient over the years that just couldn't stand it, but most people can at least hold their nose and drink it. But it's really not too bad. And I would take it for 10 days after a tick bite. Can children take this? Yes, they can. How much should they take? I can't tell you on a video like this, just that it's safe for children. And way safer than any antibiotics, of course. So anything that says stevia is harmful is not based on very good research. I've read tons of research on stevia before I started to recommend it to patients. I studied it for more than 6 months, everything that's available and a lot of stuff that's not available, because I had access to a school that had special research on this. So the long and the short of it is, should you treat with something after a tick bite, what are the odds that I'm going to get Lyme disease from this? Well, nobody knows the true odds, but we do know that at least 1 in 3 ticks in some places in the country do have Lyme organisms in them. Now, so let's say your odds are 1 in 3. If you knew that you had a 1 in 3 chance of eliminating the risk, or at least dramatically decreasing the risk of Lyme disease by doing one of these 2 strategies, would you do it? Well, that's up to you. I'm not saying you should do it, but as I said, a lot of patients approach me and say, should I do it, or can I do it? Will you call in an antibiotic for me? So the stevia is just an alternative, especially if you're going to be getting recurrent tick bites, as some people do. So there's other things we can do that dramatically decrease the odds of getting tick bites that I'm not going to go into here. This is just a strategy that you can do if you get one. So I hope you found this helpful. God bless, and have a great day.